You've walked past first, second, third trimester, labor pain, and delivery. Now your baby is here. Congratulations! The first 2 months of a newborn's life are full of changes and learning. So in this video, I'll be walking you through the different changes that your baby might experience in the first 2 months after delivery and the healthy tips for you to navigate through these changes. So don't go away. Hello, beautiful people. If you're just joining, my name is Daisy Peter, a content creator based in Port Harcourt. I'm a mother of 3 beautiful children, and all I share here is pregnancy tips, healthy tips for your baby. I talk about motherhood journey. All my teachings here are based on personal life experience and research. I'm not a medical doctor. Please still consult your doctor if need be. Let's dive into today's topic, which is the changes you're to expect in these first 2 months of your baby's delivery, and then how to thrive past these stages. We are going to be discussing this in two main sections. Number one is the things you're to expect, and then the number two section are the tips, the healthy tips for you to navigate these 2 months life changes in your baby's life. So let's dive in. So like I said, number one is what you should expect in your baby's milestone in these 2 months. And in this category, we are going to dissect it in different changes, in different phases. Number one thing we are going to talk about is feeding, what you should expect in your baby's feeding habit. This is just a newborn baby. So expect multiple breastfeeding for like 8 to 12 times a day. Yes, it's very normal. Your baby is going to be looking for breast milk for like 8 to 12 hours a day, and between the intervals of 2 to 3 hours. And this breastfeeding even happens more in the night. They want you to breastfeed them very well in the night. When this happens, do not worry. It's one of those things you expect in the first 2 months after delivery. Number two, expect wet diapers. You can have up to 6 diaper change in a day, including poo. They will poo, they will wee. So you're looking at changing of diaper up to 6 times a day. And in this diaper change, let me give you these tips. If you're a new mother, after changing your baby's diaper, please don't wear them the diaper directly. Ensure you rub them Vaseline. I will recommend Blue Seal Vaseline. It works like magic. And what this Vaseline does is that it prevents your baby from having nappy rash. If you don't apply any jelly cream in your baby, it will result to nappy rash. So after each diaper change, endeavor to apply your Vaseline. It will prevent nappy rash. The number three things to expect the first 2 months after delivery is sleep. Your baby can sleep for like 16 to 17 hours a day, and this sleep can be in batches, can be in stretches, but after the calculation and all that, you find out that they sleep for 16 to 17 hours a day. Do not panic. I know as a first time mom, we all did it. Even now as a third time mom, I still do it. When I find out that my toddler, my baby is still sleeping, I will go and check to people, is this child okay? Is she all right? And all that. So it is very normal for your baby to sleep for a very long time. But please, if you notice that they are sleeping for a very long time, just you can wake them and make sure that they are okay, then they can go back to sleep. Do not allow them to stay for sleep for a very long time. This sleeping habit always scares mother. You feel like, is your child still okay? But you just go close and find out that they are still breathing. Then you sign this heavy sign of relief. But on a serious note, if they are sleeping, please do not allow them to sleep for hours without stretching, without breaking it. So you can always check up on them. And then secondly, to this sleep, they sleep for a very long time during the day. In the night, just get ready to stay awake, because they can be awake. A child that wants to deal with you can even stay awake between the hours of 9 p.m. till 6 a.m. in the morning. And I'm not even joking about it. So the first 2 months after delivery, the sleeping pattern of a child, in the daytime they sleep for a very long time, while in the night they stay awake. They will make you not to sleep. And in a case where you don't have any help, just get ready that you're not going to sleep in that night. Number 14 to look at in the first 2 months of your baby's delivery is growth. Yeah, they start growing. From this time, you start noticing that their facial countenance will change. Some of them will look at you and they will frown or either smile. Yeah, some of them they start seeing at this 2 months. And then they will start gaining weight between 150 to 200 grams. So these are the changes you should expect in your baby's growth within 0 to 2 months of their delivery. Then on lastly, for things you should look out for in their first 2 months, they start body movement. Some of them will start moving their hands, their leg. And you know, when you give birth to a child, mostly their arms are always closed. So at this point, you see they've started to open their arms. Though there are some children that from the day you gave birth to them, their arms are opened, their eyes are also open. Unlike those days that when mothers they give birth, it will even take a very long time before the child will start opening eyes or the arms. But children of these days, they grow so fast. The growth is so rapid that from month 2, they're already moving their arms, they'll be kicking it and their legs. So these are the signs that you should expect in the first 2 months after delivery. So now let's talk about the healthy tips to apply the first 2 months after delivery. Number one, breastfeed. Do not be stingy with your breast. What a breast milk does to your baby is that it builds their immune system, and it also helps in the brain formation, in the brain development. So don't follow pattern. Don't say that this baby just sucked 2 minutes, 3 minutes ago. Once they give you signal, just give them breast. They need your breast milk at this very point in time. I know that there are some mothers that do not really produce milk after delivery. It takes them some days. Please, you just look for a good baby formula, a good baby milk, and give them. Just start giving baby food immediately. But once the milk starts coming, please don't fail to breastfeed your child. It's very important for the brain development. Another healthy tips is practice safe. When baby is asleep, please do not lay them with their tummy. Lay them with their back for some security reasons. Lay them with their back. No pillow, no toys around. Just lay them with their back. Number three tips is tummy time. What is tummy time? Tummy time is that time that once in a while you use their tummy to lay them. Yeah, this helps them to stretch, and it also helps their muscle and some of their bones to start growing. While they are trying to stretch, it helps them in growth. So once I know I said you should not lie them with their stomach, that is when they are sleeping. But if they are not sleeping, you can introduce tummy time in this milestone. Lay them with their stomach so that it will help them to stretch, because this practice strengthens their neck and their shoulder muscle. Number four, keep the cord clamp neat and dry. Please make sure, I will recommend, that is what I do for my children. Every 1 hour, please make sure you always clean it, because you know that thing is wound, is injury. So if you don't clean it often, it's going to have some bad smell. So you want to always clean, make sure you're always keeping it dry, clean it. And please do not pull it out, allow it to go to cut off naturally. Continuous cleaning will make it to cut off naturally. And there's one thing I also want to state. I don't know why some mothers are always in a hurry for them to remove that cord clamp or this thing. Don't remove it, allow it to cut naturally. Children are different, so they will know they will not, all of them will not be the same. Some of you will say, when I gave birth to my child, it cut at 1 week. Do they give trophy? No, every child is different. So don't force your child on. Just clean it continuously, and when it is time, it will fall off. My third child one wasted a lot of time. Almost 1 month it was still there, but the most important thing is that it was not smelling. So at the appointed time, it fell off. So please don't use energy, don't use your hand to cut it. Just continuously clean it, and it will cut off by itself. Then after it has cut off, then when you're bathing the baby, you can now use hot water to massage a little. Then after massaging, you use your Vaseline to rub it. I will always recommend the Blue Sea Vaseline, because I think that Vaseline heals wound very fast. So it's very good. Number five, bathe gently. I know this point I just raised, African mothers are out of this table. When I gave birth to my children, I could not stay there and watch them bathe my children, because the massaging was too much. They would press here, press it. I told them no. God gave them the head. God knows why he gave them this size of this thing. Don't massage. Not to maybe trying to massage, or you will not break the muscle, because as a baby, as a child, their muscle is very soft, that any area you adjust it will go to that way. So what if in the process you break the baby's leg? So just bathe gently, don't massage too much. So that's on that. The number six tips is avoid visitors holding your babies, especially for those who have not taken their. Sometimes after giving birth, they tell you that the BCG vaccine is not available yet. So in this period, while waiting, do not give visitors your child. And if you must give, please ensure that their hands are properly washed. Like me, if I even go to visit a new baby, I hardly carry them, especially if they've not even taken that vaccine. I hardly carry them because they are still fragile, and any little thing they can contact bacteria. So avoid people carrying your baby. Another tip is that please don't fail your immunization dates. Your immunization dates are the dates that are given to you by your hospital for you to come for your baby's vaccinations. Yes, these vaccinations help in the growth of your baby. They help in so many ways. So please endeavor to go for your vaccine. I think we have the one of first month, second month, third month. Yes, after the third month, you will now go for the one for the 6th month. So please endeavor not to fail any of these immunization visits. Then 7, lastly, please always track temperature and behavior. If you notice a strange behavior in your baby's attitude, or they did not act the normal way, maybe it's a child that have been sleeping, all of a sudden they're no longer sleeping, they're running temperature, please call the attention of your medical doctor. This happened to my sister, one of my sister. She gave birth, this baby was sleeping, all of a sudden the baby was not sleeping again, and thank God that she was so sensitive, the husband was so sensitive. So when they got to the hospital, they checked and they discovered that the baby has been infected in the blood. And this maybe people were carrying the child without washing their hands and all that. And I advised earlier that in these first 2 months, please do not give your baby to any and anyhow person, no stranger, no visitor, unless their hands are properly washed. And then they also discovered that the blood level was very low. So imagine the mother, the parents, they did not notice this on time. What would have happened? So always watch your child for any strange behavior. If they exhibit any sign all of a sudden from nowhere, please call the attention of your hospital. So that is all we have for today. But that being said, remember that this period is very overwhelming because you're learning, so is your baby also learning. Both of you are novice, you don't know anything in this period, so it can be very overwhelming, especially when advice is coming left, right, center from nurses around you. Everybody will just have opinion and all that about your baby, about your baby's milestone, to the extent you might even get confused of they want to implement or not. But with lots of love, attention, and care, you and your baby will thrive in these first 2 months. Hope you found value in what you watched. Please, if you did, do not forget to like, comment, and share this video to other new moms so that when they give birth, they will know what to expect and the healthy tips to practice for their baby. Thanks for watching, and see you in my next one. Bye.